Good morning, everyone. Thank you for joining us here today at our Sam Street Government Center here in DeKalb County in Decatur, Georgia. My name is Commissioner Ted Terry. I represent the Super District 6 on the Board of Commissioners here in DeKalb County. It is an honor to have such distinguished guests here today that are all collectively working in an integral part of DeKalb County's continuum of care service system. Those who have been intercepted by the court system, the jail system, mental health and substance abuse system here in the county. And based on current lifestyle situations, have a higher probability to be caught up in this web and intertwining system to talk about the root causes of homelessness and really trying to address the cycle that continues to weaken the core and the foundations of many in DeKalb County, from parents, families, and certainly children as well. And again, my name is Commissioner Ted Terry. And so as a commissioner, we do a lot. We pass laws, we have hearings, we fund studies and plans, but we also appropriate funds. And one of the really amazing things about the work that we get to do on the county commission is every morning I open up my inbox on my phone, and all of the problems of society are in my inbox. People who are asking about paying their water bill, paying the rent, questions about every manner of thing you can think about that are problems in America. DeKalb County is dealing with those exact problems and issues. And today we actually are really trying to bring together all of y'all who are here in the room with us, and certainly anyone who's watching at home can participate as we move forward, because one, we want to be collaborative in the work that we do. The Board of Commissioners is just one part of our governing authority. We're the legislative branch. But working with our CEO and the administration, all the departments that provide services throughout DeKalb County, with our court system, with our constitutional officers, our Solicitor General, District Attorney, our judges, all of the court systems are such vital players in the conversation that we're having today. And we are having a lunch and learn, so glad everyone could be here for a little bit longer period, maybe during your workday. But it is a lunch and learn, so you're getting a little bit of food, but also an opportunity to have this discussion and hear the research that we're going to go through, and then have an opportunity for us to have panel discussion as well as questions from the audience. And then also we will be talking about next steps forward, because this is just one little small piece of a multi-pronged effort that is happening between the Board of Commissioners, our health partners with Board of Health and Claritel, and all of the players here in the room today. So today really is focused on the research project. And about maybe a year ago, we had been discussing mental health, about crisis response, homelessness. We're really diving a lot more into this issue because, again, open up my inbox, and on a regular basis, constituents are asking, what are you doing about the person who is on Memorial Drive living in an extended stay hotel? What are you doing about the individuals who are out in encampments around DeKalb County? What are we doing about those who are leaving the DeKalb County Jail? What are the opportunities that we have to ensure that they don't go right back in to the criminal justice system? And thankfully, over my years of service going back to the city of Clarkston, I had a great connection with our speaker and primary author here today, Ms. Priya Srinivasan. I say that right, close enough, and who did just some amazing work with us in Clarkston, mostly focused on children and reading at the time. And so we met with Priya last year and really just talked about the need for more research, for more data collection, and for us to kind of bridge the different sectors of this work to dive deeper into this issue. So without further ado, let me introduce the author of the report that we're presenting today, Priya Srinivasan. And not exactly sure what MSc, MSD, Doctor, PhD ongoing. So you can explain all that, but that's a lot of abbreviations and titles. Priya was born and raised in India. She moved to the United States over 2 decades ago. She is a scientist with over 23 years of research expertise in evaluating the safety and efficacy of biomedical interventions developed to reduce HIV acquisition, specifically in women. Her work has helped advance novel prevention platforms to human clinical trials. She has authored and co-authored over 25 manuscripts and presented at several conferences. She also was the co-founder and voluntary CEO of the nonprofit Developing Resources to Educate All Mankind Incorporated to support children's education from 2021 to 2023. She's a certified QPR suicide prevention training instructor and voluntarily trains communities with life-saving suicide prevention awareness techniques, aiming to break the stigma and taboo around mental health. Priya also holds a Bachelor's of Science and Master's of Science in Biochemistry from the University of Madras, Chennai, India. Also received her Master's degree of Biology from Texas Women's University in Denton, Texas. Priya is driven by her passion and deep commitment to support community well-being. She went back to school after a 20-year hiatus to pursue her doctorate, ongoing. And she's completing the doctorate of public health at Georgia State University, a goal she looks forward to completing in the coming year, and recently got her life coaching certification as well, and is working towards her first level of International Coaching Federation accreditation. And so let's just give Priya a round of applause for being here and for all the work she's done and continues to do. Before I introduce Priya, I want to recognize our distinguished panel that will be has joined us here today and will be speaking after the presentation, and we'll have a little curated panel discussion to get a little bit deeper into the data that Priya is presenting on. So first, we are joined by the Honorable Charles E. Bailey. Thank you, Judge Bailey, for being here. The Honorable Judge Charles E. Bailey presides over Division A4 of the State Court of DeKalb County, where he has served full-time since January 2022. He is licensed to practice law in Georgia, Tennessee, and New York. Judge Bailey previously served the state court as a pro-hack judge and as a part-time in the municipal court of Decatur. He worked as a sole practitioner in the law office of Charles E. Bailey and as a registered neutral with the Georgia Office of Dispute Resolution, qualified in general civil mediation, arbitration, domestic relations mediation, and specialized domestic violence mediation. And before pursuing a career in law, Judge Bailey worked for a community mental health center providing intensive case management services to people with chronic and severe mental illness. He's also worked for several years in the field of higher education, administration at Vanderbilt University. Judge Bailey also serves on the ministry board and board of trustees of Developmental Disabilities Ministries Incorporated. He previously served as chair of the board of directors of Oakhurst Recovery Program. Judge Bailey also earned his JD from Vanderbilt Law School. He is the father of 2 adult children, and he and his family reside right here in Decatur, Georgia. Let's welcome Judge Bailey. Thank you. I said distinguished panel, didn't I? It's a good experience here. All right, next on our panel to introduce is Kareem D. Martin. Thank you, Kareem, right there. Kareem is a seasoned professional in healthcare administration and public health leadership with over 14 years of experience in managing clinical operations, clinical data and analytics, and care coordination across various healthcare settings. His expertise spans over Medicare and Medicaid services, home health care, hospice, primary psychiatric care, acute critical care, and correctional health care. Kareem currently serves as the medical liaison for the DeKalb County Sheriff's Office under Sheriff Melody Maddox and Health Services Manager. Mr. Martin oversees and evaluates staff, ensures optimum utilization of medical services, investigates health services complaints, and conducts audits for compliance with NCCHC, which is the National Commission of Correctional Healthcare, and ACA, the American Correctional Association, federal accreditations. Not to mention also Leadership DeKalb alum 2024, the second best class ever, next to 2019 when I was Leadership DeKalb. Kareem is also actively engaged in community and serves as the medical and mental health reentry liaison and services on the DeKalb County Opioid Task Force and the DeKalb County Behavioral Health Coalition, something we're going to talk about near the end of our program. And Mr. Martin's extensive experience also includes roles such as surgical service office administrator and EMT, paramedic at JFK Medical Center, crisis continuous care supervisor at Vitas Hospital, hospice, and clinical data analysis at Medicare Part B and C. He holds a BS in healthcare administration and management from South University, and an MBA and MPH from California State University, Long Beach, and Argosy University, Orange County. Let's welcome Mr. Kareem Martin. Thank you for being here. All right, and then finally, our third panelist joining us here today is Mr. Eric Watts. Thank you, Eric, for being here. Eric is a dedicated professional with nearly a decade of experience working with justice-involved individuals across Georgia. With a master's in social work from Clark Atlanta University, Eric specializes in health and mental health, currently serving as the clinical director of substance use services at Claritel Behavioral Health. As a licensed clinical social worker, he brings a wealth of expertise from diverse settings, including outpatient care, crisis intervention with the Behavioral Health Link Mobile Crisis Unit, and inpatient services for those facing severe mental health challenges and substance use issues. Eric's work is grounded in a deep commitment to meeting clients where they are, focusing on strategies that help them avoid incarceration and connect to essential community services. His holistic approach underscores the belief that every individual deserves support and the opportunity for rehabilitation. Let's welcome Mr. Eric Watts. Thank you for being here. All right, so without further ado, I want to introduce Priya to brief us on her research and findings. So we're going to do a little PowerPoint presentation, and then we'll have some panel discussion, and then we also want to open it up to our distinguished guests who are also here in the audience with us to have dialogue and questions, and then we'll close out with sort of next steps. So Priya, come on up, and let's welcome Priya to the stage.
Good afternoon, everyone. It's a real pleasure and honor to be here. Thank you for taking time out of your schedule to attend my post-practicum presentation titled Mental Health Conditions and Homelessness Evidence-Based Solutions to Break the Jail Cycle in DeKalb County. So I'm going to give you an overview of 8 months of my work with Commissioner Terry in the next 40 minutes. So I have divided my talk into 4 sections. The first section would cover the unmet needs assessment of people experiencing homelessness and mental health conditions in DeKalb County. I'm going to use some PIT counts and data kindly provided by Claritel Behavioral Health to cover that aspect. Then I'm going to jump in a little bit on criminal justice involvement among people experiencing homelessness. Then I'm going to, thank you. The latter half of my talk is going to focus on evidence-based solution to break the homelessness jail cycle in DeKalb County, and then through a housing first approach, and then I'm going to finish off with my recommendations to address this critical issue. So as I mentioned before, the first part of my talk focuses on unmet needs assessment of people experiencing homelessness and mental health conditions in DeKalb County. Approximately 653,000 people experienced homelessness on a single night in 2023 in the United States. That is 20 individuals for every 100,000, the highest number since 2007. You may all know, but just for more clarity, the point-in-time count is a census of people experiencing homelessness in both sheltered and unsheltered settings. And the counts are provided by 3 different household types: household with at least 1 adult and 1 child, households without children, and households with only children. You all may know HUD, which is the U.S. Department of Housing and Urban Development. It requires its continuums of care to do a yearly census of people experiencing homelessness and in sheltered settings, including emergency shelters, transitional housings, and safe haven. HUD also requires its COC to do a census of people experiencing homelessness and in unsheltered settings every other year. It's normally done in a single night in January, and I had the honor of accompanying Commissioner Terry for a pit count that was done back in January. So exciting. Thank you, Commissioner Terry. So these are some of the findings that I had put together in my year-long work with Commissioner Terry approximately. So this gives a figure. These two figures represent the pit count trend. That's the point-in-time count trend in DeKalb County for the last 10 years. It's all HUD-based data, publicly available data. And I've used Georgia numbers for comparison. For example, in 2023, approximately 12,200 people experienced homelessness in Georgia. It was a 124% increase since 2021. When we look at DeKalb, approximately 438 people experienced homelessness on a single night. Again, please in mind, this is just pit count data. On a single night in January in 2023, which represents a 119% increase between 2021 and 2023. Again, further categorizing the data available through HUD, we stratified the data based on population and racial demographics. So populations between the ages of 45 and 64 make up 41% of those in unsheltered settings in Georgia. But if you compare DeKalb, populations between the ages of 45 and 64 make up 67% of those in unsheltered settings. Going on to the racial demographics, Georgia has an approximate equal distribution of white and black in unsheltered settings. If you focus on my graph on the right, you can see that 84% of those in unsheltered settings in DeKalb County are blacks or African Americans. We explored this data even further. So like in emergency shelters, 1/3 of the occupants in emergency shelters are children in Georgia. But if you compare it to DeKalb, approximately 1/2 of the occupants in emergency shelters are children. Going on to the racial demographics, 73% of those in emergency shelters are blacks, while 93% of those in emergency shelters in DeKalb County are blacks or African Americans. The last set of data that we had put together for those in sheltered settings were from transitional housing. As you can see, less than 1/3 of the occupants in transitional housing are children in Georgia. When you take the same setting in DeKalb County, 61% of those in transitional housing are children. Shocking demographics, but reality, 41% of those in transitional housing in Georgia are African Americans or blacks, but when we compare it to the statistics in DeKalb County, 94% are African Americans. Blacks or African Americans represent 55% of DeKalb County citizens, but as I had shown previously, 84 to 94% of those in unsheltered and sheltered settings are African Americans or blacks. And HUD defines a person experiencing homelessness with disability as experiencing chronic homelessness. They have a number of conditions. I'm going to try to spit out what I try to memorize, but they should be in a place which is not habitable for human occupancy, in emergency shelters or safe havens, and they should have lived in that condition for 12 months at least, continuously, or at least on 4 separate occasions, which when combined together equals 12 months, and the break between those occasions is like 7 consecutive nights. And the next criteria of people who can satisfy as being chronically homeless in order to receive their services is people who enter institutional correctional facilities. It could be jails, it could be mental health or substance use treatment centers, hospitals, but they should be in those settings for less than 90 days, but complete all of the criteria that I mentioned above. And the last set of people they consider to be eligible for chronic homelessness is an adult head of household, again, who satisfies all of the conditions. So this is PIT count data. I've listed all the source of the data at the bottom of my slide. So this PIT count data is from Dr. Batchelor, who kindly shared it with us from DeKalb County. As you can see, there's been a 63% increase in the length of time people experiencing homelessness between 1 to 5 years from 2022 to 2023. So this was data that was available. But as you all may know, there's a paucity of data available on those experiencing mental health conditions and substance use disorders in DeKalb County and homelessness as well. And again, the PIT counts are just a single night count. So it may not be an exact reflection of those experiencing mental health conditions or homelessness in DeKalb County. So we approached Clairtel Behavioral Health, formerly known as the DeKalb Regional Crisis Center, to request de-identified data to serve this project. And the understanding that the population served by Clairtel is likely not to represent the actual numbers that may exist in DeKalb County was acknowledged. We wanted to use the resources available to put together this study. And approximately 5,240 individuals were served in Clairtel between July 2020 and June 2023. Just to highlight the racial demographics of the 5,240 individuals who were served in Clairtel between the periods that I mentioned before, 74% were blacks or African Americans. And as you can see in the graph on the bottom, the living conditions of those seeking care in Clairtel, 87% were found to be experiencing homelessness and not staying in shelters. 8% experiencing homelessness and staying in shelters, and 15% were experiencing chronic homelessness. I hope I've given you I have limited time. I could go on at length, but I'm just going to jump gears to explain criminal justice involvement among people experiencing homelessness. Again, these are publicly available manuscripts, research projects, and all that we pull the data together. This is Prison Policy Initiative findings. It has been estimated that individuals who are previously incarcerated are 10 times more likely to experience homelessness. And people who are subjected to the revolving door of jail, jail incarceration and release experience 13 times, up to 13 times higher homelessness than the general public. We all may know that the U.S. incarceration rate at approximately 614 people per 100,000 is the highest among independent democratic nations. Georgia incarcerates people at the rate of 916 per 100,000, which is 33% higher than the United States, and it is even higher than some of the countries that I have in the graph there. And moreover, as you can see from the graph on the right, African Americans are present at a higher population in both jails and prisons in Georgia, and they are incarcerated at a rate 2.7 times higher than the whites. Since no exact data was available with regards to DeKalb County incarceration rate for this project, we used Atlanta's estimates for comparison. DeKalb County's population at 762,000 is approximately equivalent to Atlanta at 510,000. And blacks or African Americans represent 54% and 48% respectively in DeKalb County and Atlanta. Oh, the main point, I forgot that. 1 in 8 city jail booking in Atlanta involves a person experiencing homelessness. That is 12.5% of those that are booked for various things. And this is like 31 times higher, which is shown on the bar, on the yellow bar or the orange bar on the left, 31 times higher than the total proportion of people experiencing homelessness in Atlanta, which is 0.4%, but they are being incarcerated at a rate of 12.5%. And so, again, due to the paucity of data, we went back to the data that we had obtained from Claretel to see if there was any link. As you can see, 42% of those that were served by Claretel between July 2020 and June 2023 had a history of incarceration. And 24% of those that were served by Claretel between that time period were arrested in the last 5 years. A number of studies are coming out recently that demonstrate the existence of proxy indicators of people having serious mental illness. So the Criminal Justice Coordinating Council did a first of its kind study to estimate prevalence of mental illness among Georgia County jails. So they used a data set that was available from the 9 county jails in Georgia, and they estimated the prevalence of mental illness. 14% of those who were booked had mental illness. 9% of persons booked had mental illness, and they say that the above estimates are likely to be conservative or underrepresented because the data sets that they had used, for which I believe a person must have had a felony conviction history. And they say that nearly 50% of those booked in the data set did not have a felony conviction history. So the same report provides some proxy indicators that can be useful in diagnosing if people may have mental illness. People who are incarcerated may have a mental illness. They say 81% of those with a mental health flag have more than one booking episode, twice the length of stay, twice the number of cell movements per booking, and almost twice as having pursued criminal activities between the time that they were arrested first and the most recent. And the report also indicates people experiencing mental health conditions are present at twice the rate in Georgia County jails than compared to the general population. And among this population, they report that people experiencing homelessness were twice as likely to have mental illness. And this is general data, but essentially, unfortunately, the U.S. prisons and jails hold people with serious mental illness at nearly 10 times than those present in state mental health hospitals. And one report had even said the prisons and jails have been essentially referred to as the new asylums. And approximately 50% of local, state, and federal inmates meet the criteria for the presence of a substance use disorder. And this study, for which I had included a graph, shows that all levels of opioid usage is associated with criminal justice involvement in the past year. So with all this background data that we had collected and with the scarce amount of data that we had, we wanted to see if a similar situation existed in DeKalb. So we reached out to key stakeholders and decision makers like Mr. Karim Martin, Judge Bailey, Judge Martinez, for their qualitative expert inputs. So we all may know that the DeKalb pretrial facility is the largest facility in Georgia for local, state, and federal cases. I'm sorry, city, local, and federal cases, and has a 3,800 bed capacity, and the average daily population is 2,200. And from the great inputs that Mr. Martin had shared during my stakeholder interview with him, 57% of those in DeKalb County Jail experience homelessness, and 80% have a mental health or substance use disorder. And we also went back to the clerical data to see the existence of this co-occurring disorder. As you can see on the right, 62% of those that receive services between the same time frame that I've repeated a number of times, 62% have a substance use disorder, 12% have mental health diagnoses, and I think 26% have co-occurring disorders. So that's just to give you a snapshot of criminal justice involvement among people experiencing homelessness. The latter half are the evidence-based solutions to break the jail homelessness cycle. The whole focus of my project with Commissioner Terry is to come up with recommendations and solutions to address this problem. We all agree that all of us need a safe, affordable, and decent housing to live in. People with mental health conditions, trauma, or other challenges need a home where they can get the treatment and begin their recovery process. A prison policy initiative reports that examined over 50 studies to determine if housing is a central strategy to reduce prison and jail population, estimate that 45% of adults diagnosed with serious mental illness in the U.S. have a co-occurring substance use disorder. And people with such dual diagnoses are 12 times more likely to be arrested than individuals with neither conditions. And at least 63% of those individuals experiencing homelessness and mental health conditions will be arrested and 48% incarcerated during their lifetimes. So this is the housing first approach that we want to suggest. Traditional support efforts have primarily focused on increasing clients' housing readiness, requiring total sobriety and psychiatric treatment compliance in order to receive permanent supportive housing. The housing first approach, it does not precondition supportive housing on sobriety or compliance to treatment. It was developed by the Pathways to Housing to meet the needs of people experiencing chronic homelessness. Here's more data to show how Housing First works, and it's established all across the country and the world. Housing First programs offer permanent supportive housing with wraparound mental health, substance use support services, and case management. HUD defines permanent supportive housing as permanent housing in which housing assistance is provided and supportive services to assist households with at least one member with a disability in achieving housing stability. A systematic review by CDC has shown that Housing First programs decrease homelessness by 88% and improves housing stability by 41% in comparison to treatment first or treatment as usual. And a HUD report released in 2017 estimated that 52,000 individuals who left the incarceration system directly entered shelters. The target population that we are interested in, as I've explained before, are frequent users of the criminal justice system, experience homelessness, mental health conditions, and even emergency medical services. So this diagram put together by Cunningham et al. Shows that people who often commit low-level offenses that include public nuisance, violations, alcohol and drug use, panhandling, and trespassing, when not connected with appropriate follow-up services, when they leave the incarceration system, they are subjected to the same negative cycles. And it affects both their health, and it's a huge burden, economic burden on taxpayers. And I discovered that through my conversations with Judge Bailey and Judge Martinez as well, that they are unfortunately connected with repeating trespassing and other activities. So public health focuses on logic model. So this is a supportive housing logic model that describes how this intervention of housing subsidy and supportive services would provide intermediate and long-term outcomes. For example, with housing subsidy, the intermediate outcome would be increased housing stability, and the long-term outcome would be decreased involvement with the criminal justice system. With regards to supportive services, the intermediate outcomes would be decreased crimes associated with homelessness and increased access to health care. And the long-term outcomes would be increased appropriate healthcare services and improved health. So we researched two evidence-based programs that were found to be effective through permanent supportive housing to break the homelessness jail cycle. So I'm just going to present an overview of those two programs. The first one is called the Frequent User System Engagement Program, or FUSE. We know that the community spends billions of dollars on services that essentially shuttles people between shelters, hospitals, jails, prisons, but the positive human outcomes that come from it are quite limited. So there's a corporation called the Corporation for Supportive Housing, which launched a multi-year interagency collaboration called Returning Home Initiative that engaged several jurisdictions across the country to implement permanent supportive housing and to break the incarceration homelessness cycle. As these individuals, as we've seen from the background information, also face physical, mental health, and substance use challenges, the model integrates along with housing agencies, agencies that support criminal justice and behavioral health as well. This first program, this FUSE, was introduced in New York back in 2006. The reason why they did it was with a growing reentry concern and 40% of inmates released from New York City jail being reincarcerated within 12 months of their release. The FUSE 1 program, pilot program, was launched in 2006. I've listed, just to give you an idea how this is a multi-stakeholder, multi-collaboration effort. So it is the FUSE 1 program was a collaboration between the CSH, service providers, and advocates concerned with the reentry population and administrators from New York City agencies, Department of Corrections, Housing Authority, Department of Health and Mental Hygiene, Human Resource Administration. So for this pilot program, they used the data match between jail and public shelter records and placed 100 formerly incarcerated frequent users into permanent supportive housing. So the criteria was 4-4-5. They should have had 4 shelter entries, 4 jail entries in the last 5 years. Because this is a pilot program, they wanted to evaluate the outcome. And they used jail and public administrative records to determine match controls based on demographics and mental health diagnoses. So at 1 year, the FUSE participants had over a 90% housing retention, a 92% reduction of shelter days, and 53% reduction in jail stays. The cost offset was approximately $3,000 per person per year to the jail and use of public shelter systems. With such success, the program was expanded and FUSE 2 was conducted, where they doubled the number of inmates who were engaged in this program. So they received permanent supportive housing either in scattered site housing, and the services were provided through mobile case management team and other staff, or single site special needs housing operated by nonprofits with on-site services in mixed tenancy buildings. So the rental costs were subsidized such that the tenants paid no more than 30% of their income or their housing allowance benefits. So again, just to give you an overview, we've analyzed this quite extensively, but at 12 months, 91% of FUSE 2 participants remained permanently housed, versus 28% among the controls. At the end of 2 years, 86% of FUSE 2 participants remained housed, while it was 42% in the comparison group. The increase in comparison group was because they were being placed in supportive housing at a greater rate. And the number of days of shelter use from housing placement over a 2-year period was 15.2 in the intervention group versus 162 days in the control group. And the number of days in jail was almost twice lower in the in the group that received permanent supportive housing was 25.7 versus in the control group it was 47.6. Fuse also did a 10-year long-term study to determine if stable housing would be an effective solution to bring about sustainable change in the lives of these people. So they had determined 10-year trajectories where they were followed from when they were interviewed or they had entered the incarceration system to 10 years following that. It was a time period. But 63% of Fuse participants had no jail or shelter experience after the first few months in the shelter, while it was 37% in the comparison group. That's where the different colored bars indicate. And among controls, trajectory classes with multiple jail episodes, with even one class where incarceration dominates throughout follow-up. That's the 10-year period. Essentially, what Fuse program participants had experienced was little or sporadic shelter use and almost no incarceration over the 10-year follow-up period. And this is where I think this is the money slide. Fuse had determined that the cost savings are approximately $15,700 per individual through reduced jail and public shelter usage. So they had calculated a first outlook of cumulative savings that would be achieved, that was achieved through the implementation of Fuse. So Fuse program saved per person over 5 years an estimated $108,000 with reduced jail incarceration and over $25,000, that's a typo, on shelter stays. So Fuse helped achieve an estimated $45,000 per person reduction on publicly funded jail and shelter costs. So they conservatively estimated that if all the 1,000 participants that were a part of this program had received the Fuse supportive housing services, permanent supportive housing services, the amount of saving would be equivalent to $45 million in 5 years. And the above-mentioned $45 million savings does not include the costs associated with medical and behavioral health services. That's just jail stays and shelter usage. Switch gears a little bit, and I'm going to talk about the Denver Supportive Housing Social Impact Bond. We all know that Denver has increasing problems of homelessness and chronic homelessness. In order to, and there's an intricate involvement, as we've always seen from my background information, the intricate linking between criminal justice system and people experiencing homelessness. So Denver has adapted programs and policies to change the approach of criminal justice system to that of a preventive one. So one such program is the Denver Supportive Housing Social Impact Bond. It's a social impact bond or pay for success financing that was launched in 2016. So through a performance-based contract, the city of Denver leveraged $8.6 million in upfront capital from 8 lenders, private lenders, to fund supportive services and a limited amount of flexible rental assistance as needed. State and federal housing resources and reimbursement for a share of Medicaid-covered supportive services was obtained through the program as well. So the city of Denver agreed to repay the private lenders potentially with a positive return if the initiative worked as per performance measures set prior to the contract and validated by rigorous evaluation. Again, please keep in mind these are pilot programs that are being launched across the country to see the effectiveness. Again, just some details. Denver Social Impact Bond is a supportive housing initiative that combines a permanent housing subsidy with intensive wraparound services, which could include a modified assertive community treatment team, behavioral health services linked to community resources, and transportation assistance and referrals, because they had scattered site housing and single site housing options as well. So the target population, again, we defined as all individuals that had had 8 or more arrests over 3 consecutive years with the Denver Police Department. And 3 of those arrests had to be transient, meaning that the person had no physical address or given a shelter address. They identified 724 eligible participants who were then randomly assigned to receive either permanent supportive housing or the control group, or be in the control group. So of the 363 people that were randomized in the treatment group, 285 were located, engaged, and housed, and 361 participants were receiving community care as usual. So the key findings of that study was that 560 more days of housing assistance over 3 years was achieved in those people that had been a part of the permanent supportive housing than the control group. Excluding those who died during the observation period, 86% of the participants remained in stable housing after 1 year. At 2 years, 81%. After 3 years, 77%. There was a 40% reduction in shelter stays in the 3-year period because of supportive housing, 34% reduction in police arrests, police contacts, and 40% reduction in arrests, 30% reduction in unique jail stays, and 27% reduction in total jail stays, and 65% reduction in use of detoxification services. And I'm not going to go through the rest, but there are some other medical benefits that were obtained through this program as well. Again, just to give back what are the cost savings that were achieved by this pilot program, half of the total annual per person cost of the Denver Social Impact Bond was offset by reduction in cost of other public services. So $6,800 was spent less annually per person associated with avoided outcomes in comparison to the control group. So my next point shows what are the avoided outcomes. Jail stays, which accounted for $2,300 approximately per year, ambulance rides, and emergency department. And the bottom graph shows the different government systems that are involved in supporting this measure. As you can see, the city and county of Denver had the greatest amount of avoided costs among the government funding sources for the various services. So they provided an overall projection as to how it would benefit the city and county of Denver. They say that scale up to serve all the 1,209 people experiencing chronic homelessness in DeKalb County, in Denver County, would cost between 14 and 18 million annually. 8.3 million of the total cost would be offset by saving in other services, which I had mentioned before. Denver would see the largest cost savings with 4.5 million in cost offsets. This is in comparison to what the city and county of Denver would need to make, which is approximately 4.8 to 6 million if they were contributing to the jail and shelter service use. So it's ideally showing that expansion would maximize the return on investment and would allow a better use of taxpayer dollars than that achieved with the status quo. So kind of wrapping up my talk here, we had put together some recommendations to break the jail homelessness cycle in DeKalb County. So the first recommendation that I propose is a data-driven problem solving through a multidisciplinary task force. A specialized multidisciplinary task force across county agencies, service providers, people with lived experience, and community stakeholders such as the Super District 6 office, county sheriff's office and the jail system, state courts, DeKalb County Community Development, Clayton Behavioral Health, local housing providers, community-based organizations that support people experiencing homelessness, reentry, currently and formerly incarcerated inmates of different race and ethnicities, and their families, specifically African Americans or blacks. What would we achieve by this? It is to achieve a robust and well-defined data collection and integration. We have shown that how there's a paucity of data in DeKalb County or at least there's not integration, even if it's available. And to essentially track permanent supportive housing program implementation, progress, and evaluating outcomes. And to assess if individuals are able to avoid the revolving door crisis and break the cycle between these different support centers like jails, shelters, and hospitals, and are not just bounced from one system to another. The second recommendation that we have is to develop an effective permanent supportive housing program based on the existing evidence-based solutions. And we have Oregon has listed some primary considerations to include for this recommendation. So just to name a few, it's program effectiveness, equity and racial justice, and inclusion of all segments of the community, ability to serve the entire county, ease of administration, alignment with current and state local legislation and policies, alignment with state and national permanent supportive housing best practices, program integrity, flexibility to community-specific needs, and data-driven outcomes, as I had mentioned before. The third recommendation that I have is program policy and system reforms to support permanent supportive housing. As we all have hopefully understood that permanent supportive housing is a multidisciplinary approach that requires the collective engagement of, unfortunately, the current disparate and disconnected systems. And there's insufficient and fragmented funding sources. And there's a plethora of local zoning and development regulations that disproportionately limit affordable housing and increases its cost. And we all know not in my backyard syndrome. And refusal by landlords to accept housing vouchers. And the fourth recommendation, we've gone through it in detail in the report, but I'm just giving you some snapshots. Targeted housing and services. Guidelines such as those included in the Justin Reach Pay for Success initiative, which was launched in Los Angeles, a program that provides holistic supportive services beginning when an individual is still incarcerated, that is in the Reach component, combined with permanent supportive housing on post-release. And the last recommendation that we have is a data-to-action implementation to break the homelessness jail cycle. Rapid feedback cycles to generate actionable data for improving implementation of ongoing multi-component programs. Communication with stakeholders and improving other evaluation elements. Not only achieve the above, but also bring about a culture of learning, a historical record, and increased buy-in from guarantees. So in conclusion, I hope I have convinced you that permanent supportive housing through our project that I've worked with Commissioner Terry on, permanent supportive housing can disrupt the false narratives that homelessness and recidivism are unsolvable problems. A 58.8% increase was seen in the requested DeKalb County Sheriff's Office budget for jail expenses from FY23. I've listed the numbers there, 96 million versus 60 million approximately. A 53% increase in actual jail expenses was observed from FY21, which was 46 million, to FY24. The approved budget was 70 million. So implementation, eventual scale-up, and expansion of an effective permanent supportive housing intervention can help save millions of dollars in public expenditure, maximize the return on investment, and help end the homelessness jail cycle in DeKalb County. With that, I'd like to conclude by sharing my sincere thanks to a number of people who were involved in this project. My deepest appreciation for Commissioner Ted Terry for giving me this incredible opportunity. Without his vision, support, and guidance, this project would not have been possible. And he also kindly served as my Practicum site supervisor. Thank you, Commissioner Terry. And I also want to thank his amazing team, specifically Kelly Cato, his chief of staff, who helped make this project a reality. I also want to thank Parker and Miranda, who are not here, but thank you so much. I want to thank Mr. Vandermerv and his team from Clerical Behavioral Health, who kindly provided data for my project and for his invaluable consultation amidst his busy schedule. I also want to thank Mr. Martin from the Sheriff's Office, the medical liaison, and Judges Martinez and Judges Bailey. I apologize for the typo, Bailey, Judge Bailey, from the DeKalb County State Court. And I want to thank Dr. Battler from the DeKalb County Community Development, who kindly provided the PIT data And I also want to thank Ariana Diaz from Stomping Ground Strategies, who provided the template for my presentation slides. And finally, I'd like to thank Dr. Hyman, who is my Practicum supervisor and program director at Georgia State University, who supported me through this practicum and in my DRPH journey. Thank you so much.
Thank you so much, Priya. Really appreciate all the time and energy you've spent over these last many, many months to really put together a very comprehensive, thought-provoking, and I think instructive presentation and research project. And of course, what y'all saw was the PowerPoint presentation, but if you're a nerd like me and you want to read the actual paper with even more data and maybe another couple hundred pages, we certainly can provide that, I think, afterwards. So we're going to get into our panel discussion. So I'm going to ask a couple of questions of our panelists just to respond to the presentation that Priya just provided us. And then we also will have time for our audience here as well to ask questions or offer up, their response to what we've gone over today. Before I get into the panel discussion, I want to just recognize formally many of y'all who are here with us today, because the individuals in this room were invited to be here in this room, but also to participate in this discussion because your organization's offices and roles here in DeKalb County are so vital to us addressing this issue and moving forward in a way that helps us solve it. And so, in no particular order, because I'm just looking out here in the crowd, I want to recognize Mr. Greg White, who's been working with the city of Decatur on homelessness, and appreciate you being here, Mr. White. Of course, our DeKalb County Police Chief and her representatives, Chief Martha Ramos, who has been instrumental in particular for creating the first full-time crisis response unit through the DeKalb County Police Department, something hopefully every police department in Georgia will replicate. Also, I see Donald with Solicitor General Donna Coleman Stribling's office, Lisa here with District Attorney Sherry Boston's office, and Aaron from Senator Kim Jackson's office, her Chief of Staff. We also have Sherry and Sue, who've been working on addressing the homelessness issue, particularly with our extended stay hotels and the conditions there, where thousands are living in extended stay hotels and in functional homeless. Also, Dr. Sandra Valenciano, our Board of Health Director here in DeKalb County, and Judge Hargrove and her associate judge are here as well. There's also another program on Thursday in this room talking about mental health, and that's going to be a really exciting program that we'll ensure to invite everyone to as well. And then I do see our COO, Mr. Zach Williams, here in the back. I know his ears perked up when he heard about those money savings for doing some of these programs, because to be quite blunt, there's not enough money to solve all of these problems. And so as we work forward in addressing this issue, we want to be cognizant that there are limited resources, but by being proactive and sort of collaborative, we can address those issues. Also, I see our Chief Judge, Dear Jackson, here. Thank you so much for being here. And then also Caroline Enlow from Commissioner Michelle Long Spears' District 2 office, who will ask later to come up and talk about some of the things that her office is working on later next month. Okay, so I don't know everyone who's here, but if we miss someone, we'll call them out a little bit later. But thank you all again for being here. All right, so let's turn our attention to the panel. And so I really want to just kind of start with the general question, because Priya really laid out the data and then some of the solutions based on those other models in New York and Denver. And so in no particular order, but I want to hear from our panelists. Let's start with Mr. Martin first. Just when you think about the data that was presented, that relationship between those who are coming, they're folks that you have to evaluate. They're coming into the DeKalb County Jail. Those who either are experiencing chronic homelessness or usually a mental health diagnosis or a substance abuse disorder. And so, just if you don't mind, share with your perspective, your reactions to what the data has been presented.
Absolutely, and thank you again, Commissioner Terry and Priya. Phenomenal job. Thank you for having me here today. The data, I mean, it's an exact representation of what we're experiencing at the jail, right? The number of mental health population that comes in remains, extremely high. It remains at 75, 80%. And a large percent of that number also remains homeless. And as you see in some of the data that was provided, the homeless population and the mental health population tie into each other. And oftentimes the homeless population, their first goal or their first track is to try to get home, try to get housing, versus trying to get treatment as a second option. And putting that burden on the jail, of course, one of the responsibility and the liability of the jail, now we can't let these individuals, number one, go and be decompensated from not getting the appropriate treatment, so we have to facilitate the treatment, and then work with our partners, Claritel, Grady Act program, to also facilitate reentry programs for homelessness. So very, very great data. The data does match, and it's something that we try to check our boxes to, do that community engagement, to partnership with other communities, to see what we can do to facilitate a lot of these homelessness and mental health community.
Great. Thank you, Mr. Martin, for that response. And so, the natural course is that individuals will be booked into the jail. You'll work to assess them and provide those services, and then eventually they might come before a judge. And so, Judge Bailey, just respond to the data that you heard, and then, any context of how you're interacting with individuals once they're coming before you, and, and what the options are.
Sure. Well, again, also, congratulations, Priya. It is good to see you again. I had the privilege of meeting her a couple months ago and getting sort of a preview of this information. And thank you, Commissioner and Kelly Cato and the others who put today's discussion together. It's important, and I'm grateful to be here. I am sitting in for Judge Ana Maria Martinez, who's not available. She sends her best regards to everybody. As a judge, we frequently see folks, particularly on our criminal calendars, who are coming in as a state court judge with relatively low-level offenses, charges. In state court, we hear all misdemeanor offenses. And it is clear from my experience in the field, in the mental health field, that as a judge, I see folks that are clearly struggling with some mental health issues. And I have limited resources available to me as judge to have those to require, if you will, those individuals to seek those resources. And when I can do so, I have limited resources in terms of how to monitor and oversee those things. And so the result is, very often, we do see this revolving door. The same folks frequently coming in time and time again, and the sort of stereotypical example of that is the person who's experiencing homelessness, who is picked up and charged for criminal trespass, and then he serves a couple of days in custody. He's discharged or released from custody, I should say. But he has no treatment options or services that are being provided, and so it's just a matter of time, usually a relatively short amount of time, before he's picked up for criminal trespass again somewhere else. And so the numbers the data is shocking when you look at the scale of the problem. But the good news from studies and from the data that Priya and others are providing us is that there are solutions available. And so that's encouraging. In the jail, in the court system, we can't provide supportive housing services. We can't provide those sort of wraparound mental health services in the community. But we are beginning, and by beginning I mean the last decade or so, beginning to find avenues where we can provide accountability courts, mental health courts, and other ways that we can help to facilitate those kinds of services in the community.
Great. Thank you, Judge. Appreciate that response. And then just to, and then Eric Watts, through your role at Claritel Behavioral Health, formerly the DeKalb County Community Service Board, so quasi-state agency, works in the county, but also serves a larger region as part of the overall Department of Behavioral Health and Developmental Disabilities. The work that you do, I think, and I had the opportunity to visit one of the programs, the opioid residential treatment program, where you work with individuals that are trying to overcome substance abuse, get them treated, and hopefully as they kind of graduate that program, they're sort of, more self-sufficient moving forward and are hopefully breaking that cycle. And so I do want to acknowledge that it's not like we don't have any programs, but oftentimes I think it's the coordination and the coalition of seeing that there's some overlap in some of the different areas that our agencies and our organizations will tap into. So could you speak, Eric, one, just respond to the data that was presented, and then if you don't mind, kind of share a little bit about what Claritel does, whether it's in the in-reach jail system program, but also the larger community programs you offer.
Sure. Sure. First, let me say thank you for having me here. Nice to see you again, Priya. And thank you, Commissioner. In reference to the data, for lack of a better way to say it, it was refreshing to see it worded so nicely, because I think a lot of my experience has been anecdotal, but this supports it. I think one thing that really stuck out was the comments about housing first, and I just wanted to add one thing up to it before I actually talk about the services. What's beautiful about the housing first approach is it's not housing only. It's just what separates it from other standard treatment programs is you don't incentivize participation so that you can build, etc., and then give the person housing. It's social work 101. You meet the person where they are, and then you give them the housing and you build from there. So when you started talking about it, I got excited. I did realize I was on camera and I'm on a panel, so I tried not to emote too much. But speaking about our services, Claritel Behavioral Health is all over DeKalb County. We have 4 outpatient primary mental health clinics, with the 5th on the way, probably early, first quarter 2025. We also have what I'm responsible for, an outpatient clinic for substance use treatment and a residential substance abuse treatment program for adult men. In addition to that, we also have our crisis center. Another point that I took from the presentation is that it looked like roughly 5K individuals between 2021 and 2023 were unhoused. In the last quarter, about 50% of just shy of 1,000 individuals who were served at our crisis center, right now the current crisis center, were unhoused. So I think I'm grateful to be a part of the conversation being had now, which also brings me to another point, is the agency, because of the amount of unique individuals that we serve on a regular basis in our crisis center, are looking to grow and have another crisis center. I'm not going to speak above my position and start to talk about money, but it would be nice, because our current crisis center can't handle how many individuals we're servicing at the rate it is now. It's been open since 1996 and it's never shut its doors. And I'm hopeful and optimistic, and also I think thankful to be a part of the agency at a time where we're growing the way that we are. But to speak to more to the agency, what I also took away from the findings is the importance of essentially having many doors to solving this housing problem. So if a person were to find themselves in DeKalb County Jail and then find themselves in front of a judge, we also need to be there, so that it's no longer on you all to try to figure out where you can send this person. And I think that kind of comes down to effective communication, collaboration, and most, if not equally important, speed. Is you all need to know us, we need to know you, everyone else in this room, so that when a problem arises, we all can meet each other's needs. I feel like I rambled a bit, but it's from
No,
excitement.
No, that's perfect. And let's hone in a little bit on that because I don't want to harp too much on the data because we know the issue, we know the problems, but we are talking about the solutions. And so, for Judge Bailey, and one thing that I remember speaking with Judge Martinez about last year was actually at a leadership DeKalb government day that Kelly Cato put on and invited me to speak with other commissioners. And Judge Martinez was in one of the groups, and we were talking about mental health crisis response. And Judge Martinez shared that, on occasion, or maybe more than often, individuals would come before her, and they were in the jail. They were experiencing homelessness, maybe had another, mental health diagnosis, and she had expressed that she didn't feel comfortable releasing them from the jail because she didn't know what was going to happen with them out, basically out there on the streets. And so kind of the default was, well, let's just keep them where at least they have some level of treatment. And so I'm not sure, Judge Bailey, if you had that experience. Sometimes, it's kind of a tough decision. Do we keep them in a bad situation, not ideal, or a potentially worse situation? And can you just speak a little bit about sort of the choices, or maybe the lack of choices that you have?
Well, I would agree with Judge Martinez. I think all of the judges face that periodically across the state, and certainly here in DeKalb County. Again, as a state court judge, I'm dealing with folks that are charged with misdemeanor offenses. And so, by definition, it's a low-level offense. When they come before me initially, it's for a jail appearance to determine whether or not to set bond. The studies suggest that holding people in custody is actually counterproductive to our goals of having them be productive members of society. When you hold somebody in jail, they lose housing if they have housing. They lose jobs if they have jobs. They lose family connections if they have those family connections. There's all sorts of negative consequences to holding somebody in custody. There are risks and dangers to being in custody. The jail is providing the services there, but they have limited resources themselves and can provide the full spectrum of services that a lot of these folks need. So there is a lot of advantages and reasons to try to have them released from confinement, to give them an unsecured judicial release, or to set a reasonable bond that they can meet. The challenge with that is we have countervailing considerations such as public safety. And if somebody is not being treated for any particular mental illness, and they are charged with an offense, perhaps, that has a violent component to it, then we have to consider the risk that that person may pose if they're released back into the community. My concern, more often than not, is not the concern that they're going to necessarily hurt somebody else, but that they themselves may be hurt. And so that's one of the things that I struggle the most with is if I release this person from custody, they have no place to go. They have no support. They have no services available to them. And as a judge, I can give them a new court date to return, but once they leave, I have no mechanism for monitoring and following up with them to make sure they return. And then once I've lost them, that concerns me about what happens next. So I think that's an ongoing issue, is trying to balance the interests of the community and the interests of the individual defendant as well.
Yeah, absolutely. And Mr. Martin, so, would you, I imagine, once or twice a day there's a bus from Memorial Drive to DeKalb County Jail that comes to downtown Decatur for folks to have their court hearing. And, what are your reactions when, you hear that some judges are like, well, I'd love to have them go to a different system, but they're going to continue to stay with you and in your care, and recognizing that, in some situations it's not the ideal environment for treatment or for, sort of getting them back on to self-sufficiency or more permanent treatment. So, what does that mean to you? You're, clearly have a lot of work every day, 24/7, 365, and just share with us kind of the pressures and the challenges of that, and seeing the revolving door over and over again.
Absolutely. So one of the things that I have to highlight is I don't put people in jail. right? And I don't get them out of jail. But where we are in society is the fact that sometimes they are detained and they have to be maintained in the jail setting. And just like the data showed, one of our asking price for year 2024 was $90 million, significant increase from the previous year, which is also in relation to the significant increase in our average daily population. Now, realizing that, of course, public safety is an issue, they have to sometimes be maintained in the detention center, we now have to ensure that the appropriate care is provided while they're in custody. And that was probably one of the reasons that I was brought on board about 2 years ago, because society has gotten to this place where once they're incarcerated, constitutionally, we have to provide the mental health, medical, and dental services. So we're now at a place where now I do have to have a full-time psychiatrist in jail, a psychologist, a team of social workers, a team of mental health professionals, and psych techs to facilitate the mental health population, but also to have a team of nurse practitioners, physicians, physician assistants, nursing, because right now I think we're administering about 2,200 medications a month. So I have to maintain operations to fit the capacity of the jail, but also keeping in mind that when individuals are in custody, the judge might, deem it appropriate for them to remain in custody. One of the things, especially that Eric talked about, is that collaboration and that communication. When we do get to a space or capacity where that patient is decompensating and the jail no longer has the capacity to fix, or medicate or provide the solution, it is in my best interest to bring that back to counsel and say, hey, this is where we are with this patient. This is where we are with this inmate as they're decompensating. We have done X, Y, and Z. Are there any other alternative approaches that we can probably look at? Maybe a UJR, maybe getting them over to a stabilization center, and of course the resources in the population for that is extremely limited. But one of the things that we do in the jail, like I mentioned before, is making sure that I'm able to facilitate the need. The need is continually increasing, which is why our ask is continually increasing. But I've been able to navigate to provide the appropriate care, whether that is, like I said, psychosocial services, psychiatric services, medical services, dental services, in its full capacity from a holistic approach.
Absolutely. And I do want to acknowledge that, what you said, because as that budget has gone up with the sheriff's office, some of it related to direct jail services, you're acknowledging that you are responding to the issue. Full-time psychiatrists, psychologists, social work. So I just want to appreciate you and Sheriff Maddox, because it's not like, we're all, we're not ignoring this issue. We're all trying to deal with it in our own lanes. But obviously there's some intersection. Judge Bailey, do you want to respond to that?
Well, I also want to just say, and I appreciate everything that you and Sheriff Maddox are doing. I don't, to go back to the other question, I don't know any judge, and certainly not me, who is keeping somebody in jail because we think that's where they need to be getting services. It is not where they need to be getting services. And the jail should not be on the front line of, in first and foremost, being a mental health provider. That's not their role. You're doing an excellent job with what you have and with the position that you've been put in. But part of the solution here is that we've got to get the jail out of that business, because that's just not realistic. And that's not ultimately, that's not going to be where the effective solutions are. And so I totally appreciate the work that they're doing. One of the issues that frequently comes up is attorneys will say, well, what if you order a competency evaluation, then we can have them transferred to another facility where they can get treatment, and that's got problems of its own as well. So there's sort of this systemic issue that we have of trying to sort of push people into different areas where they may or may not be able to get services, but we're missing the real core services that they need, which, to go back to sort of our discussion today, I think begins with homelessness and providing supportive living. And what Eric was saying, meeting people at the very beginning where they are, not saying, well, we'll provide you services if you do X, Y, and Z. No, we have to provide them services, and then we can start making some progress. They can start making some progress.
Yeah, absolutely. Go ahead, Eric.
Let me make sure my mic. Just to add to that, Judge, one great thing about Claritel Behavioral Health is, in addition to the outpatient mental health centers that I mentioned earlier and the substance use treatment programs, we also have several specialty programs, including case management. So I think working together as a CSB, still Claritel Behavioral, but working together as a pseudo state agency with our justice partners in the community, I think this is a achievable goal. But like I said, I think I'm glad to be here. I'm glad to hear everyone else's perspectives, and I'm looking forward to what that collaboration looks like.
Yeah, absolutely. And so just in a moment, we're going to ask the audience and our stakeholders here in the room to come up to the mic and ask a question or provide a comment based on what you've heard here today. So get ready for that. I know we got some folks who want to say a few things. I would love to hear from you. But before we get to that, let me just throw out, going to the recommendations in Priya's presentation. So housing first really was, highlighted as like this is really the policy solution, and then of course there's a lot of layers to how you implement that. And so I'd love to hear just from the panel an answer to this question: yes, no, maybe, and then any additional comments you'd like to provide. So would y'all agree that the support that is needed for individuals in the situation that we've highlighted to provide alternative housing first options with wraparound mental health and substance use support services and case management? And start with Mr. Martin, and then we'll come around.
Can you repeat that question one more time?
Yes. So just when it comes to the housing first policy, with wraparound mental health and substance use support services and case management, do you believe that is one of the primary solutions that we should approach?
Absolutely. Just like Eric said, especially with the case management part, right? It's a follow through. It's a from the beginning to end process. So I'm definitely on board with the housing first. Absolutely.
Wonderful. Mr. Watts?
Absolutely. I think it's a short answer. I'll be brief, though. But the beautiful thing about housing first is, like I was saying earlier, is it's not only housing, but what it does is it takes into consideration, one, that these are individuals. These are human beings, not people who kind of need to be incentivized, but could use an opportunity to be empowered. And we just offer the services voluntarily, where if this is something that you're also interested in addition to the needs you have for housing, then we can provide that too. So I think housing first would be a great step in the right direction.
Great. Judge Bailey?
Yeah, I mean, again, as I said, I think housing absolutely is where it has to begin. I think that's what the science, the studies, the research shows. From a policy perspective, how you do that is obviously beyond what the judiciary can get involved in and can do. That's why we have legislators. But absolutely, I think that's where it needs to start. I think we need to focus on providing housing.
Okay, wonderful. I appreciate that response. And before we open it up to the audience for questions and comments, I want to acknowledge a couple things that the DeKalb County administration, CEO Michael Thurman, and the Board of Commissioners have been working on really over the last 2 years, because, like I said earlier, we receive comments and emails about these issues on a regular basis. And since I've been on the Board of Commissioners, I've had the opportunity to participate in the annual point in time count through Director Alan Mitchell's office at Community Development. And we actually meet here in this room in January. We break out into teams and we go across the entire county, municipalities and unincorporated, and we go to the areas of the county where we know have history of individuals who are on the street, in encampments, not necessarily extended stay hotels, but we're working on that as well. But I'll just share in my experience that every time that I've gone out, we actually interview people. We go through a list of questions. That's part of the federal funding. We have to go out and interact and talk with these individuals to find out more about them. And in my experience, just in this last year, there was kind of a shift. We had individuals who maybe in the past were like, yeah, I'll, get me a place, for the night. I'll go to a shelter, or if you got a hotel room, I'll do that. This year was very interesting. Not a single person that we interacted with and Priya, you were there. It was like at 1 o'clock in the morning. Did not want to go to the shelter, the Salvation Army shelter downtown. Weren't interested in the hotel room, and quite frankly, we're like, well, this is where I live. I live in DeKalb County. I'm a DeKalb County citizen, resident. I interacted with no individual that's like, I'm coming from some other part of the country, or I'm from Atlanta. They're like, this is my home. And it was interesting because there were connections in the community. I encountered one woman who was 76, 78 years old, was basically just hanging out at the Shell station at Columbia and Snapfinger Road. And she basically said that she gets a Social Security check, $800, $900 a month, but that's not enough to pay for housing. And so we said, well, would you like to go to the shelter? We can give you, a place to stay to the night. She said, no, I stay at Miss Jenkins' house on occasion, but she also said she's also just sleeping in the convenience store sort of awning at night as well. So it's interesting that there's a lot of different layers and a lot of different solutions. But what she did say is, do you have an apartment for me? Do you have a house for me? That's what I really, really would like. And this is a senior citizen, okay? We encountered another individual who admitted that he had a criminal record from years ago, and simply was never going to be able to get an apartment complex to rent to him because of that past record, low or no credit score, and then certainly no amount of money. We're talking about maybe $5,000-$6,000 minimum to go first month, last month, security deposit, and all the other fees, right? So there's a real financial barrier to that housing first approach. And then finally, I'll just recognize that in my research on the housing first approach is very fascinating because, what really I think the conversation revolves around is, okay, so individuals that are experiencing mental health conditions or have a mental health diagnosis, is that why they're homeless? Is this why they have chronic homelessness? Or does being chronically homeless cause mental health disorder? I would argue it's the latter, and just think about it in your own life. If you had to be out on the street and an environment where you 24/7, you were not safe, fight or flight, cortisol, adrenaline pumping, how long could you sustain yourself in that environment without going into what would become a mental health diagnosis? And then how could you recover from that without any treatment, without any stable housing? And so I think I do agree with the panelists that the housing first approach with the appropriate wraparound mental health and substance use support services, case management is so vital. Lastly, I will appreciate CEO Thurman and the Board of Commissioners because in the SPLOST 2 list of priorities, we did put a $15 million line item for a new crisis center through Claretel Behavioral Health. The feature of this new crisis center that we want to build in DeKalb County is that it actually would have 50 transitional housing units literally attached to the building. And so they're basically dorm units, individual units that would allow for a little bit longer period of treatment. And some of y'all may not know this, but in the crisis system, and correct me if I'm wrong, Eric, y'all cannot hold on to someone in that crisis situation for longer than 6 days, 7 days. Is that right?
Yes, that's correct.
Yeah, and so when they're released onto the street in essence, unless there's some other referral. But for the most part, they can't stay there more than 6-7 days. Is that right?
Yes.
Okay.
Generally, the crisis center tries to prioritize connecting people with programs, especially if there's a substance use component. And if there isn't a particular program and the person just wishes to discharge maybe back home, they'll still be connected with outpatient services. So.
Yeah, thank you. And so, and of course, the individuals that are experiencing homelessness, if they don't have a place to go, then they can't stay there. But the goal, hopefully, is that as Claretel moves, through that expanded crisis system and those housing facilities, they can continue to monitor individuals, to work with them, hopefully in that maybe 6-month, 12-month period, depending on how long it takes, so that more secure housing and those wraparound services can be provided. So again, those are temporary. That's in the mode of transitional supportive housing that might be temporary. And then certainly, of course, we need to be thinking about some of the more permanent situations. I think we acknowledge that some individuals, quite frankly, are going to need more of that permanent supportive housing for various reasons that we can let the experts, sort of advise us on. I do want to appreciate also, again, COO Zach Williams. Last week, the administration put forward a $6 million funding proposal using American Rescue Plan dollars as well as Emergency Rental Assistance $2 to be put towards a new transitional housing facility in DeKalb County. So again, building units that we can have available so that when between all of our panelists here and their systems, as well as our other constitutional officers working through their support systems, when the question becomes of do we have a housing unit available, the answer is not, well, there's a waiting list, or, well, we'll refer them to someone. The answer is yes, we have units available. And we're going to need to build a lot of units, so this is kind of a little down payment when what really we need is hundreds and hundreds. And of course, based on the data that Priya and have expounded upon, it's potentially thousands of individuals really over the course of a year. All right, so this is the part where we'd love to hear from our distinguished guests and stakeholders who are here in the room. And so if anyone has anything they'd like to share for the good of the whole, questions, comments, please come on up. Chief Ramos, thank you for being here.
Good afternoon. So we've been here about an hour and a half, and I have yet to hear anything about the police department. However, the police department is usually at the forefront.
Yes.
So I'm trying to think about how is it that we steer away from having police respond to situations that are not really police related. Sometimes when the police are involved, everybody always says, I'm calling, but don't take them to jail. Well, the police department takes people to jail. And so sometimes we're put into a situation that maybe would be better suited for someone else, but since there is no one else, we have to show up, and a quarter of the time someone may end up in jail that maybe could have been handled a different way.
Yes.
So we show up when there's no one else there, but who is that person that should be there? Is it communication? Do we need to kind of share some information to the community as to who they should call? Because when you bring the police into the picture, it just changes the dynamics, and everyone knows that. I'm just curious to hear what you guys' thoughts are.
Yes, absolutely. And Mr. Watts, maybe you can speak also about the new mental health hotline as well, and how that's that's going to go into the Go ahead.
Thank you for that, because you beat me to it. I think the focus needs to start prior to that initial 911 call is diverting those calls from just law enforcement response. So generally when people are in crisis, need to make more resources available without having those people to call 911, and to connect people with treatment and our services instead of just over-relying on law enforcement. Thank you for your question, by the way.
And I think that's an excellent question. And I also am a graduate of leadership DeKalb, and at a health program that we did last year, in a mental health component of that was one of the issues that we addressed and talked about was, if you see somebody who is creating a disturbance, rather than calling the police, who else are you going to call? Who knows the number for the crisis line, for the hotline? Does anybody even know that those numbers exist? And most people, the only number they know to call is 911. And so absolutely, people don't walk into court. People aren't walking into the jail. They're being brought there by the police because that's who we're turning to. And there again, that's a disservice to everybody, including the police department, who does an outstanding job, in my opinion, doing what they can with this population. But that is part of the education that has to happen, that these are not criminal, always criminal cases. It's not always criminal behavior. And so we can't always have a criminal response to them. So.
Yeah, absolutely. I do want to acknowledge what Chief Ramos said, because I do believe that, as far as I've been alive and following the issues of criminal justice and criminal justice reform, Americans, we have been trained to call 911 and expect the police and maybe fire rescue as well to take care of it for us. And to be quite frank, that system cannot continue. It cannot just be call 911, we'll let police handle it and go about our day. This has to be a community-wide approach, multidisciplinary, multi-jurisdictional, with all of our partners, and that's why we invited y'all all today, because we knew that we couldn't have a panel with everybody, because we'd be here for like 5 hours. So I'm glad that Chief Ramos shared that perspective, because I wholeheartedly agree with it. Dr. Valenciano?
Thank you. Thank you, Priya, for such a wonderful presentation. I really appreciate it. I love all the data. I love data. And of course, the solutions, fully agree with a housing first approach. This is a comment and perhaps question. What I didn't hear in the presentation, and one of the things that we need to consider when thinking about breaking the cycle and homelessness and a housing first approach, is that helps us to address homelessness but not necessarily prevent homelessness. And I'm sure Eric and Claire tell Behavioral Health, if you look at, of course, our data and who's being impacted, right? Primarily adults, 30 to 44, right? These adults were once children who may have experienced what we call ACEs, adverse childhood experiences and childhood trauma. And there is plenty in the evidence base that individuals who have experienced ACEs and childhood trauma are significantly more likely to then develop PTSD, depression, anxiety, behavioral health disorders, mental health disorders, substance use disorder. Also, they're more likely to not graduate from high school, not graduate from college, not be employed. They're at risk for homelessness, all of that, right? So as we think about solutions, it's not just about addressing our current problem and the issue of the unhoused, but also how do we think about our children who may be experiencing childhood trauma and ACEs and preventing that from occurring so that they then don't become these adults, right, that are going through this cycle. And so, making sure that we include that as part of our efforts and as part of our coalition and framework to approach homelessness in DeKalb County is also, working with our organizations and community partners that work with children, working with our school system, et cetera. And for those that don't know what ACEs are, right, it's, children that may be experiencing different forms of abuse, neglect, domestic violence. They themselves may have family members who are suffering from mental health disorders and substance use disorder. So I just wanted to make sure that I commented on that and pointed that out, because of course my job and goal is prevention. So how do we think about preventing homelessness and preventing mental health use disorders and substance use disorders later on as adults? Thank you.
If I can, I want to get a bonus point, because I actually wrote on the top of my page adverse childhood experiences in the ACE studies. I thought about that during Priya's presentation. It is really important, and it goes to the systemic nature of this problem. That it is generational. That children who grow up with housing insecurity very often find themselves experiencing housing insecurity as adults, and it just goes on the line. I don't have an answer for it, except that I do think that part of that answer is that we break the cycle. If we can provide that supportive housing today, then hopefully we're not continuing to re-experience or have other generations that are continuing to experience those adverse childhood experiences. But I'm glad you brought that up. Thank you.
Yeah.
Thank you.
Eric?
I thank you for your comment, Doctor, as well. Interestingly enough, one of the questions on that ACEs questionnaire references whether or not you've witnessed someone, a loved one, being arrested. Mm-hmm. And I think I only say that to emphasize the importance, like I was saying earlier, of communication and collaboration. What's great about Claritel Behavioral Health is that's some of the work we're doing already, is we provide services in the schools through our APEX program, and we have a department in our agencies that's just dedicated to children and adolescents. The reason I repeat again communication and collaboration is because the more frequently we work together, the easier it should become to recognize trends that we see and to meet the needs of an entire family as opposed to just the individual who is arrested or incarcerated. So.
Very good point. I also believe psychosocial services starts at an early age. And, one of the conversations I had with Decatur School Superintendent Dr. Whitaker was the approach of having psychologists or psychosocial services from a high school standpoint, from an educational standpoint, where we have guidance counselors, and of course they're providing guidance from an educational standpoint, but having a psychologist from a school standpoint to help them navigate and understand some of the mental health underlying issues, because it's not always about psychotropic medication. A lot of it can be done and facilitated through psychosocial services or psychology services from an adolescent age, understanding family dynamics, understanding from a social worker standpoint, and getting them engaged and start to navigate that from a middle or more or less a high school standpoint.
Yes, absolutely. And thank you, Dr. Valenciano, for bringing that up. And I'm hoping that our friends who have been working specifically with the individuals living in extended stay hotels might say something as well. I did have the privilege of attending a meeting that Senator Ken Jackson put together last night on Memorial Drive, where we brought together many stakeholders, including residents who are experiencing really very awful conditions living in these somewhat deplorable and some really deplorable extended stay hotels, to which we are intending to do a more thorough census pit count just for those individuals, because the latest data from the Community Development Department that is mostly informed through the school system, through self-reported data, is that about 1,300 children who are in the DeKalb County school children are what they call McKinney-Vento homeless. And so they're either doubled up living with some other family, they're in a domestic violence shelter, or they're living in an extended stay hotel. And I don't mind sharing that as I've gone out to the Haven Hotel and the conversations and testimony that we got last night, that the parents as well as the children living at these extended stay hotels are witnessing violent crime, including murders. And so just that alone, that experience, is awful. Not to mention the lack of stable housing and how that impacts their own ability to do well in school. One of the young men, young kids, fifth grader, he basically I was asking him at our little break, and I said, how's school going? What are you learning? And he just said, well, I missed school yesterday, because we just couldn't get from the hotel the transportation to get to school, so he just missed school. Simple as that. And I don't need to preach to this group, but anyone ever heard of the school to prison pipeline? I've been hearing about that for decades. And so as we talk about the immediate issue of what we're seeing in the jail and the court system right now with adults, as Dr. Valenciano I think has pointed out, if we don't focus on the proactive measures that will in that school to prison pipeline, or at least bend the curve downwards, then we're going to keep having these same issues over and over again. And so, this is something that we're really focused on working on in the immediate term. We did approve the final emergency rental assistance 2 funds, approximately $13 million, that are being distributed to several nonprofits around DeKalb County. They're still working out the paperwork, so hopefully that money will become available very soon. But the Board of Commissioners' intention with that allocation of funds was to really support in a kind of a focused way the school-age children that are functionally homeless, particularly those who are living in domestic violence shelters and the extended stay hotels, to provide at least some financial support, whether it's in the short term, just to be able to pay the $600 a week on average that they're paying to stay in these hotels, and or have that first month, last month security deposit, that proactive rent payment, so that they could hopefully move out of that situation into a more stable, what probably would be an apartment complex unit. Although we did hear last night from a mother who said, can you please get me a house? And so that's not lost on us as well, which is again why we need to build more housing units of all types to support where folks are at and their stage of life. So I think we have time for one more comment question. So yes, sir, introduce yourself, please.
Emil Risby. I'm the medical director for the Georgia Department of Behavioral Health and Developmental Disabilities. Two comments. One, 988, that's a new number. It has been promoted as a suicide prevention number, but in Georgia, if you dial 988, it's the same people who answer the crisis line. So, and they have the ability to deploy a mobile crisis team in lieu of the police department if that's the situation. And they may ask for the police backup, but a mobile crisis team is available to deploy. Proud to say in every county in Georgia. It might take us a little longer to get there in some places, but every county in Georgia is covered by a mobile crisis team. I want to say, Priya, there's one set of data you didn't have access to show that this program works. When an individual is sent from state court to the state hospital because they're incompetent to proceed, and it's a plus or a minus. It's a negative because it generally takes about 9 months now to get into the state hospital. But once they're there, generally their charges are dismissed because they're too mentally ill to commit a real crime, so they got arrested for their mental illness. And so we're allowed to discharge them from the hospital. No one hardly ever goes to a shelter. Less than 2% of our discharges across the system goes to shelters. And those requests have to come up to my office. I review the chart to make sure that the person's mental illness has been adequately treated and that they're making a coherent decision to go to a shelter where preventing them from leaving the hospital borderline on unlawful detainment. Okay? We go through a whole list of reasons why you can't go to a shelter. And almost always individuals will agree to go to some sort of housing. Now, it takes a while sometimes because we have to get their benefits done. So you can't sit in jail in some case waiting on a benefit. In the hospital, we have social workers that'll do that. If you were born in Mississippi somewhere and you don't have a birth certificates, we got to work to get that. And so it takes a while, but it works. I'll just give one quick example. It's the pre-COVID example, but it makes the point. We had someone whose main issue was getting repeatedly arrested at the airport because he was homeless. And of course, when they asked him to leave, he wants to fight the officers. And last time he asked officers to come outside because he didn't want to get blood on the floor when he beat them up. At any rate, we decided that it didn't make sense to send him back to jail after he became competent. So we called the solicitor and said, can we just discharge him? Can we just have him? Just let us have him. There was some pushback initially, but I reassured him that we were going to put him in a personal care home that was not on the martyr line, so there'd be no way this guy could get back to Clayton County to be a problem for you anymore. Well, all of a sudden, it was a deal, okay? And so we were able to release him. This was pre-COVID. He had about 8 arrests up until that time. We haven't seen him since because we got him into a personal care home. We got his benefits. He has money. He started some supportive employment thing. He has a life now. And so just want to let you know, it takes time, it takes money, but these programs work. Thank you.
Absolutely. Thank you so much for sharing that and appreciate you. And I want to give a shout out to DBHDD Commissioner Kevin Tanner, who has actually been really just the amazing advocate to address just the overall mental health funding in DeKalb County, going to the legislature, asking for funds, working with us here in DeKalb to support expanding the crisis system. I understand that we're looking to expand the state hospital as well down at Panthersville, and so we're working through our watershed department to address the sewer capacity needs that would be needed with that expansion. But certainly we want to see that happen because the need is there. As you pointed out, there's a long wait list to get there because the capacity is constrained. Also recognizing that Commissioner Tanner has pointed out that he wants to build more housing units as well, sort of in that same complex. So again, our state leaders are thinking about this, our local leaders, the court system, the sheriffs, the police. This is really good. I mean, we're really, I think, all speaking the same language, and where we have some intersection and some overlap, we really can achieve, I think, a lot of very positive outcomes for individuals who, at the end of the day, as I like to say, there but the grace of God go I. If we were in those situations, we would be there just like them. We were fortunate that we didn't have that situation, or maybe we did have that situation, but along the way someone helped us or provided that additional support that we needed to be where we're at today. So I really want to appreciate everyone who's been working on that. All right, so just to close us out, I want to call up Ms. Caroline Enlow from Commissioner Long-Spear's office, our District 2 Commissioner. So we are, again, we are working in a very collaborative way. I like to say Team DeKalb, okay? And even though we have our own constituents and constitutional requirements and our own lanes, we've got to be a Team DeKalb. And so we're very just grateful for Commissioner Michelle Long-Spears through her role as the chairwoman of the Planning, Economic Development, and Community Services Committee. Through her leadership, she has created a working group going back several months now that is entitled the Behavioral Health Services Coalition. And Ms. Enlow is going to talk about the upcoming Unhoused Summit on November 14th, which will be a continuation of what we're talking about here today. And to the extent that individuals in this room haven't been able to engage with the coalition, I think many of y'all have, this is the invitation to be more involved, because a lot of this work moving forward is policy, it's funding, but also interagency and cross-jurisdictional collaboration. So, Ms. Enlow.
Hi. Oh. Maybe there. Thank you all for coming today. And I just want to echo everything that Commissioner Terry said there at the end there, but for the grace of God, go I. This work is directly in line with our Charter for Compassion, which the Board of Commissioners passed a year ago. And we appreciate the integrated effort by all departments and local government, city, county, state. Yes, we are all speaking the same language, and there's some great synergy happening here around many of these issues. I bring greetings from Commissioner Michelle Long-Spears, and I would like to invite you all to the Unhoused Summit meeting on November 14th at 9 a.m. We will be in the Maloof Auditorium unless the commission has moved here to Sam Street, but that will be advertised. This is going to be a work to plan for a broad coalition of government and non-governmental organizations working in the unhoused space to approach these issues from all angles, and we invite the courts and police and anybody else who wants to join us on this journey. Also, there is an unhoused housing plan as part of our housing plan that is going to be developed with Claritel. Maybe you mentioned that. June of 2025 is when it's supposed to be complete, and I'm sure Commissioner Terry did mention our Housing First legislation that is before the Board of Commissioners. So many good things happening in this space, and we just are excited that you all are here today and hope you'll keep coming back for more. Priya, thank you for your presentation.
Great. Thank you, Ms. Enlow. And just to wrap us up here, just a couple of more acknowledgments. And so on Thursday, Judge Hargrove, our probate court judge, is also having a program all day. Judge, do you want to mention that real quick, or someone from your office just talk about that, and certainly extend an invitation to anyone here and listening at home to join if possible?
I can. I am very much looking forward to what will be the DeKalb County Probate Court's 4th Mental Health Symposium. It will be on this Thursday, the 31st, which is Halloween, and registration starts at 7:45. It'll end approximately 3 p.m. I will say that we already have a packed house for in-person. We have about, well, I'll just say very near 100 in-person and about 145 who have registered for virtual webinar. So you still have an opportunity to register for the virtual portion, but we unfortunately will not be able to accommodate any more in-person participants. But we're looking forward to it.
Yes.
It's the 4th. It's going to be great.
Wonderful. Thank you so much for your leadership and continuing that work. It does take all of us. So thank you. I hope you all can join for that. So, and then just final acknowledgments. Thank you to Muhammad at Spring Greens Cafe. Muhammad's there in the back for the amazing charcuterie board. Local restaurateur in Eastlake, right there at Glenwood, yes, near the East Lake Golf Course, and really amazing food. Try the bean pie. Have you ever had the bean pie? It's really good. That's sort of the specialty. I like the mac and cheese personally, but appreciate him catering the event today just for our lunch and learn. Thank you to Mr. Rodney Reese, the facilities director at the Sam Street building here, for helping get everything set up, as well as DCTV in the back. We were the guinea pigs as our first sort of kind of full live program in this room, which will be and Diamond Lewis, our director of DCTV, is back there. This will be our new home for the Board of Commissioners about mid-November, I think, for maybe about a year. So we'll be having our commission meetings here, our committee meetings here, and other programs. So we appreciate facilities, the planning department, DCTV, for getting everything set up. And then also thank you to our panel, Judge Bailey, Mr. Watts, and Mr. Martin. Thank you all so much for your time and energy and your perspective here this afternoon. Really, really appreciate it, and we look forward to working with y'all moving forward. And then finally, thank you to Priya for the amazing research over 8 months, working on all of this data collection, the interviews. Simply, this would not have happened if you hadn't put in a ton of work. And so let's just give everyone a round of applause, including Priya, for the amazing effort today. And with that, we'll close us out, and we'll be happy to hang around for additional questions or comments. But again, thank you all, and have a great rest of your day. Thank you.